Well, welcome, James. James, why don't you just do us a favor? Why don't you start by introducing who you are and how your field connects to adoption and foster care for the community to know about?
Thank you. My name is Jim Rodriguez, and I am the Director of Trauma-Informed Services for the McSilver Institute for Poverty, Policy, and Research. It's the Poverty Institute for the NYU School of Social Work, the Silver School of Social Work. And there I'm the Director of Trauma-Informed Services. As the Director of Trauma-Informed Services, I basically oversee our whole portfolio and set of offerings around trauma-informed care. Um, but also for myself, I'm also a licensed clinical social worker and licensed psychologist in New York State. So I come at this from a variety of angles. I've done research. About 20 years ago, I was doing research after 9/11 on kids affected by the 9/11 trauma, and I worked on a trauma treatment project. And then after doing research, I went back to clinical practice and I worked at a school-based mental health program treating kids with trauma. And then back into my present position as Director of Trauma-Informed Services, focusing a lot more on training and understanding trauma-informed care on a broader scale. So yeah, that's where I come to it from a variety of. Oh, and I should also mention I'm a private practitioner. So because I really appreciate and value clinical work, I still maintain a private practice where I work with children and adults, and I do have a fairly strong expertise in the area of trauma. So I do quite a bit of trauma treatment in my private practice.
So you brought something up. I'm going to jump. This was a question that I was going to ask you. What what made you or what got you to do the services after 9/11, and what brought you to be interested in so much about trauma? Was there something that was just something as you were growing up and you went, this is just something that led you to it? Was it a path that you followed? Why trauma? Why do you feel that this was something innate that you wanted to do?
You know what? I've never gotten that question before, and despite the work that I've gotten, I think it in part, I have to say I do remember as a fresh social worker, right out of social work school in the early '90s. I worked in a school-based program doing therapy for kids with severe mental health difficulties in schools. And I remember at the time just being overwhelmed that working with kids who had suffered severe trauma. I remember one kid in particular who was 9 years old, 8 years old actually, grew up with a mom who had severe mental illness, who had serious problems with substance abuse, who had been neglected. The child had been neglected, and he was living with his grandmother. And I remember presenting about him, and he had all kinds of developmental delays, behavioral difficulties, and problems. And I remember talking about him in a staff meeting and sharing and doing kind of a case presentation. And I remember one of my colleagues turned to me and said, what this makes me think of is, kind of when you're walking down the street and you see, a pile of garbage and you're just disgusted by it and you just don't know what to do with it. And I just remember being so shocked at my core because what he was expressing in really horrible ways was the idea is that sometimes you have these kids who suffer so much and who've gone through so much, and you don't even know where to start. And I remember that experience, and I remember how it left me feeling like I need to learn more. So in many ways, part of the journey started with me returning to school, getting my PhD in counseling psychology, because I was really interested in how do you treat kids, and how do I deepen my skills and ability to treat any child. And then fast forward, after I got my degree, I always had, sort of my sense in doing this work is that trauma is always there. I can't say that I kind of developed a specific interest in trauma until I returned to New York and ended up working on the trauma treatment project, where I began to learn so much more and understand, in a strange way, kind of understand retrospectively what I had been doing. And in some ways, some of the things that I had been doing that were really spot on in terms of doing good trauma treatment unknowingly, kind of just by instinct, and then some of the things that I could do new and that I could do better in terms of trauma treatment. So, and then from there, just all the work that I've been doing since then in the area of trauma has been deepening my skills in treating trauma, with an interest in understanding how pervasive it is and how much it is in pervasive in society with children across service sectors, across populations, and then of course to bring it back to um, the association and the conference. Of course, you know, when you're working with children in adoptive and foster care settings, uh, the you can pretty much be rest assured that 100% of those children have experienced trauma at some level, right? At some level, it is a guarantee, just by the nature of the population and adoptive services and foster care. So that's why I do the work, and I think that's why the connection to the work that the association does.
Why do you think it is so hard for society or the community um, to accept trauma um, and being trauma informed? I know so many people are trying to get it as something globally for in school. Why is it so hard for parents to realize that their traumas of their past go to how they parent, and foster families and foster kids and adoptive families just don't seem to want to grasp it? What is so hard that you feel of why this is so difficult to get it out there to everybody?
That is a great question. And I think I can't number them. I'm just going to go through just off the top of my head. Number one is the topic of trauma is in and of itself difficult, right? It is difficult to hear the stories. It is difficult to hear people's pain associated with trauma. There are also, in many cases, taboo topics, right? In some cases, we're talking about severe physical abuse, sexual abuse, incest, all these topics that are topics that you just they're considered taboo, even within the sectors that we work in, even among mental health providers. Right? We don't go there for a variety of reasons, and so that's number one. Just that the kinds of traumas that people experience and the stories that they experience could be these taboo topics, but then associated with that is again the nature of the stories themselves. They're taboo topics in general, right? You don't have these conversations. But number two is they're, of course, extremely emotionally laden. So hearing the stories become difficult. And oftentimes for the folks who've been victims and or survivors of childhood trauma and severe adversity, they sometimes are reticent to tell the story for a variety of reasons. Sometimes actually they don't want to tell the story because they don't want to overwhelm. And I've heard people express this. They don't want to overwhelm providers or overwhelm others. But also there is, because there's taboo, right? Those topics remain in the shadows. And then sometimes it is providers themselves. So as I shared in my story earlier, sometimes there's a belief that there's nothing I can do with that. That's especially when it's such severe trauma and adversity. And thinking about kids in foster care, for example, who may or who may have been adopted and who've been institutionalized their whole lives with severe developmental delays. Oftentimes that can be overwhelming. Like, what am I supposed to do with that? How can I treat that? I mean, they have developmental delays because of their trauma. So, and so sometimes there's this disconnect between sort of where the kids and youth and parents are right now and a thorough understanding of their trauma. So those are a few off the top of my head that keep those topics in the shadows.
So why don't you tell everybody what exactly are you going to focus on in your workshop?
Well, so I think specifically on understanding this a little bit more. So, from my perspective, trauma informed services and trauma informed care is different from trauma treatment. I can do trauma treatment. I've been trained in doing trauma specific treatment, and what that normally means is treating PTSD. To put it simply, right? Oftentimes, the trauma treatments that are out there, the evidence based trauma treatments out there, have been developed specifically focused on treating PTSD, and in some cases, complex trauma. But the reality is that first, only a small percentage of folks exposed to traumatic events actually develop symptoms of PTSD. So oftentimes what you're actually treating is something else, and it may not be PTSD. And again, given the example, it could be other sort of other disorders that may be the result of exposure to trauma and severe adversity during childhood. It could be developmental delays, some combination of the two. It could be substance abuse problems, right? So oftentimes that's the first point. And then the second point is that oftentimes without an understanding of trauma, it can lead things to things like misdiagnosis and poor treatment, because again, if you're not taking into consideration the history of trauma that the person has experienced, you're going to miss the target. So in many ways, the presentation is going to be about that. It's going to be talking about how trauma plays itself out and how it might show up differently than PTSD, so that we're not thinking about that and understanding all the different kinds of disorders. And I put that in quotes because oftentimes it's even hard to focus and target one disorder. And from my perspective, again, sometimes that history of trauma can lead to behaviors and mental health difficulties that are associated with the trauma, but because they're not necessarily, or because they're related to trauma, can, from my perspective, mimic those disorders. And that's what oftentimes leads to these misdiagnoses. And so again, my goal is to try to help people understand that. And then more importantly, how to get help and how to advocate for themselves to get the kind of help that they need, and be able to make sure that, especially in the context of adoptive and foster families, understand how to advocate, how to tell the stories of trauma. And oftentimes, because of, as you suggested, it's often missed. And it's often missed by providers, by schools, by others, where we need to educate them and let them know exactly why what you're seeing, the behavior you're seeing, the difficulties you're seeing, the challenges that you're seeing are trauma-based, and then how to take a trauma-based approach to providing support and help.
I think I've learned over the years that trauma seems to be a very taboo word itself. I find that a lot of people just, because as soon as they say trauma, they're like, well, I don't have any trauma. I'm like, everyone has something.
Right.
It could be, I'll call little or big or whatever. Everyone has something, but I think everyone has that misconception of that word. It's like that, a triggering trauma word for trauma. It's hard because a lot of families, adoptive and foster families, are learning that there is trauma in utero. Many adoptive families adopted infancy thinking clean slate, we're good, and not
Right.
realizing that it goes back all the way to in utero, which is something I actually learned. So
Well, and it actually, when you think about it, though, and I often talk about this in my trainings, to understand not trauma as, again, a diagnosis and just focused on PTSD, but the different forms of trauma. And I think what you're also suggesting, not only in utero, but intergenerationally, right? So trauma is
absolutely
transmitted, intergenerationally in a variety of forms. And so yeah, even pre-utero.
correct, correct.
So I think oftentimes, I think that's the other piece that's critically important for people to understand. And I should say, which is even more difficult to explain to folks, right? Because that involves this complex set of physiological and psychological factors that lead to that transmission, that can be difficult to explain and understand. But yeah, we know obviously that's an element to all this.
When you were going through your journey in this field, I love asking this question. I ask it to everybody. I always ask whether or not you had any favorite books that helped you with your journey, or you like to have families read, or mentors. I started adding mentors in recently. Was there anybody that you looked up to or read, or that, and it doesn't have to be foster care or adoption related. It could be of anything, of how it drove you through your journey in your career.
Yeah, so I would say early on in my career, I remember the work of Tony Manarino and Judy Cohen. They are the developers of trauma-focused cognitive behavioral therapy. And I remember some of my my first work on this trauma treatment project that I mentioned earlier. We were training providers, clinicians in the field to do trauma treatments. And so I remember their work, and trauma-focused cognitive behavioral therapy has turned into a very well-known and widely used trauma treatment for kids affected by traumatic events. And it's specifically set out to treat PTSD. But I just remember learning from them in general about how trauma plays itself out. And I will say one of the things that I remember from Tony Manarino that has to do with this issue of diagnosis that I always carry myself. Again, he's well-known clinician, and does amazing work. But I remember when we had the discussion and he had the discussion about diagnosis in his presentation, and he was explaining, the characteristics and the symptoms of PTSD. But he goes, you know what? At the end of the day, and he asked the audience, he goes, what do you all think about diagnoses? And people were like, he was like, you know what? I'm not a big fan of diagnoses. At the end of the day, what I know is somebody's going through pain, and that pain is associated through to their experiences. And what I'm trying to do is help them deal with that pain. And I've always carried that throughout. But in addition to that, and I'm actually a little bit excited because if I understand correctly, Bruce Perry is
Yes.
going to be keynoting your conference. So
Yes.
I would also sort of I love his book. I've read his book, The Boy Who Was.
There's another book he just came out with Oprah yesterday. I think it was out. It came out. There's a new book with Oprah.
Oh wow. I'd be looking forward to that. I'll definitely, and I didn't realize that. But that book is also an amazing resource because of how he tells the story of the impact of trauma in a variety of settings and in a variety of ways, and how he expands the idea of trauma, and again the various ways in which it impacts young people, and then his neurodevelopmental model of intervention I think is really amazing and helps to think outside the box when you're considering the interventions that come to play. So his discussions around the use of activities and music and rhythm and physical activities as ways of addressing and treating trauma, right, that go beyond the stuff that I was originally trained on, the talk therapies, is just marvelous work, and I think where the field needs to be going. So those are two. One that I would consider a mentor, the other I consider sort of an icon and someone whose work I follow. But those are two folks that I think have made a great impact on me. And there have been others. Judy Herman, reading Judy Herman's work on trauma as well. So yeah.
The last question is, if you could tell everyone who's watching this, why is it so important to come and see you speak and have watch your presentation? What would you tell everybody of what's so important?
If you are seeking information on trauma and want to understand trauma beyond the understanding of the diagnosis of PTSD and how it impacts children, youth, and families, because that's the other critical piece to this, come to my workshop, and then you'll have a better understanding, I hope, of, again, the different forms of trauma that are out there, how trauma can play out in a variety of ways, and then also some of the ways in which you can use that information to advocate on behalf of children and youth and families that you work with.